Good evening. Tennessee's health commissioner was on the hot seat today about her spending on the state's COVID response following an exclusive NewsChannel 5 investigation.
The legislature's fiscal watchdogs wanted to know more about a multi-million-dollar no-bid contract that Piercey signed with a politically connected company with no experience.
That deal was first uncovered by our chief investigative reporter, Phil Williams. Phil.
Well, Vicki, lawmakers were firm but polite, recognizing that navigating the pandemic has not been easy for the state's health department. Their questions were at times tough. Still, the health commissioner was unapologetic.
But this contract bothers me greatly.
The legislature's Fiscal Review Committee called the special hearing.
Unfortunately, I think what I'm hearing is something about a culture.
Amid the questions about the state's deal with Nomi Health.
I've been trying to learn as fast as everyone else.
A Utah-based startup with no experience in testing. Cost to taxpayers $26.5 million.
This company offered 90,000 tests a month. I'm not even sure we had done 90,000 tests total. In fact, I'm pretty certain we hadn't even done 90,000 tests total then.
Health Commissioner Lisa Piercey told the committee that Nomi had been introduced through the governor's office by another state that has signed up the company. The truth is, a Republican political consultant contacted the governor's chief of staff, who put him in touch with Piercey.
It sounds like even at the very outset of this, there was an opinion that this vendor was improper or this process was improper. Please tell me that we can get out of this contract.
Piercey claimed her staff never warned her that the test might be faulty. In fact, there were already headlines from other states, and her own lab team wrote a memo warning of false negative results.
What I hear anecdotally is, well, there are people in state government who have been doing X for 25 years, but there seems to be an echo chamber at the top that gets to make all the decisions and nobody's asking us. I'm hearing words like handcuffed and stifled and why are you paying me to do a job that you're not asking me to weigh in on?
Instead of his promise to deliver medical gloves, Nomi provided Tennessee with breeder's gloves that are designed to be used with farm animals. And when the test did indeed prove faulty, Piercey agreed to pay the company nearly $6 million to get out of the contract.
These guys seem like they had no idea of testing, PPE, or anything else, but the state bought a bill of goods. Do you feel that way?
Actually don't, sir. You know what they say about hindsight. I think we made the best decision that we could at the time with the information that we had.
Now, Commissioner Piercey, on one hand, argued that what made the deal with Nomi Health so enticing was that they were offering up personal protective equipment like masks and gloves at a time when PPE was, in her words, like gold. But when pressed about the poor quality PPE provided by the company, her defense there was to say that PPE was just a very small part of the contract. You can read all the emails we uncovered at NewsChannel5.com.